Okay, Logan, my name's Sydney. I'm going to be your nurse for today.
Alright.
If you could stand up for me and just walk from right there to there. Good. You can sit back down. And how old are you?
23.
Good. And can you say your full name for me?
Logan Wade Wright.
And what's your birthday?
5/18/1998.
Good. And what year is it right now?
It is 2021.
And what month is it?
It is November.
Good. By a brief conversation with the patient, I can tell that he has normal thought process. His gait is normal while he's walking. He is alert and oriented. He doesn't seem disheveled. His appearance is okay. I'm going to test cranial nerve 1 first. Can you close your eyes for me and put down your mask? You can just cover one nostril for me. Take a deep breath. What do you smell?
Alcohol.
Okay. You'll do the same thing with the other nostril. Take a deep breath. You smell alcohol?
Yep.
Okay. Cranial 1 nerve is intact. I'm going to look in its eyes. Pupils are around 4 millimeters each, equal and reactive in both eyes. And that's cranial nerve 2. And can you tighten your jaw for me right here? Good. For cranial nerve 3, I'm going to check his looking outward and up, and outward and down, and inward and up. You can follow my finger. That's intact as well. For cranial nerve 4, I'm going to check down and inward. That's intact. For cranial nerve 5, I'm going to touch his face with this cotton swab. Can you close your eyes, please, sir? And tell me where I'm touching at.
My right cheek.
Good.
My forehead.
Good.
My left cheek. My right temple. My left temple. And my chin. And my nose.
Good. That would be cranial nerve 5. Cranial nerve 6 is looking side to side. You'll just follow my finger. Good. Cranial nerve 6 is intact. Cranial nerve 7. Cranial nerve 7. We're going to go to cranial nerve 8. Cranial nerve 8, tell me what I whispered to your ear, okay? Can you cover your left ear?
Red.
Good. I'm going to check your other ear now.
Blue.
Now I'm going to check cranial nerve 9. Cranial nerve 8 was intact with the whisper test. If you can stick out your tongue for me, sir. Cranial nerve 9 is intact with gag reflex. Cranial nerve 10. Can you take a swallow for me, sir? Good. And can you stick out your tongue for me? Okay. Good. Cranial nerve 10 is intact. Cranial nerve 11. Can you move your shoulders up and down for me? Good. Can you press up against my hands? Good. And now can you push up against my hand with your neck? Same with this side. Good. Cranial nerve 11 is intact. And then cranial nerve 12, can you say bright light dynamite?
Bright light dynamite.
And let me watch your tongue, just do it again.
Bright light dynamite.
Good. Cranial nerve 12 is intact. So first I'm just gonna start by checking his skin. The skin seems to be warm and dry. Don't see any lesions of any kind. Gonna check his skin turgor. It's non-tinting. Like I said before, it's warm and dry, non-tinting, no lesions, and how it feels seems to be okay, and everything seems to be intact. So next I'm going to look into his eyes. His sclera seems to be okay and intact, no redness. Same with the conjunctiva on both sides. As previously seen, he can move his eyes every direction, and Perla is accounted for. He doesn't have any problems with moving or accommodation with his eyes, and they're equal and reactive. I'm going to take a look at his nose next. As seen before, he could smell through both sides of his nose. The outside of his nose is without lesions. It looks normal. The inside of his nose looks normal as well. No lesions or septum deviations. I'm going to take a look at his outer ear. Everything looks normal as well with his ears. Now we're going to take a look and listen to his neck. No JVD is present on his neck. Trachea seems to be midline. Can feel a carotid pulse on the right side. Can also feel a carotid pulse on the left side. I'm going to listen for a bruit on his neck. You can turn your head that way. Take a deep breath in and hold. Good. No bruise noted on the right side. Do the same thing on this side. No bruise noted on the left side as well. If you could stand up for me, sir. I'm going to be feeling for his thyroid. The thyroid does not seem enlarged in any way. It seems normal. You can sit back down. Actually, I'm going to get you to stand back up. Sorry about that, sir. You can just turn to the side here for me. I'm going to check the symmetry of his breaths. If you'll take a deep breath in on the count of 3. You ready? 1, 2, 3. Good. Breath seems to be symmetrical. If you'll bend over just a little bit for me, sir. Spine seems to be straight in the back, without any curvatures going one way or the other. Now if you'll take a deep breath, or if you will say 99 for me each time you feel my hand touch down.
99.
Okay.
99. 99. 99. 99. 99.
Okay.
99.
Good. One more time.
99.
There, I was just checking for tactical phrenitis in his back. Gonna listen to his lung sounds on his back now. Take a deep breath for me. Good. Good, and another one. Good, one more. Another one. seems to have normal breath sounds and normal symmetry when he's breathing. Don't feel any abnormalities in his back. Okay, you can turn around and sit down. Now I'm going to listen for S1 and S2 of his heart sounds. Good. Now I'm going to listen with the Z formation for the rest of the heart sounds. Now I'm going to listen for his apical pulse and a rhythm. The rhythm and rate seem to be normal at the apical pulse, and now I'm going to feel the apical pulse. With my hand, if you can just lean back for me, sir. I can feel the PMI, or point of maximum impulse, right where the apical pulse was, and it feels normal. You can sit back up for me. Do you have any pain right here when I'm touching down?
No.
Good. Do you have any pain right here?
Nope.
Okay. And tell me if you feel any pain while I'm filling your lymph nodes.
Nope.
Any pain?
Nope.
Feeling his cervical lymph nodes in his neck? Any pain throughout that whole process?
Nope.
Good. Okay, so next I'm going to check his radial pulse. Seems to be present and normal, +2. Same with his brachial pulse in his right arm. Just checked his left radial pulse and it seemed to be a +2 on the left side. And same with the brachial pulse on the left side. If you can put your arms straight up like this for me, sir. Good, and just hold them there. Now press up against my resistance. Good. Good. Now if you can squeeze my hands tightly. Good. Now if with just this arm, if you can put it out like this and pull up against me. Good. Now push away. Good. Same with this arm. Pull up against me, push away. Good. Now if you could stand up for me and do a circular motion with your arms. Good. Any pain when you're doing any of those activities?
No.
Good. Okay, you can sit back down. You're gonna check his cap refill in both of his arms, or his fingernails. Less than 3 seconds on the right side. And less than 3 seconds on the left side as well, good. Now we're gonna check his deep tendon reflexes. Seem to be intact there on the right side. Now we're gonna check this way. Seem to be intact there on the right side. We're going to check on the left side now. You can just leave your arm length there. Get a reaction there for deep tendon. You get one there on the left for that. Okay. Next, we're going to lay him down and inspect his abdomen. So if you can just lay down here for me, please. We're gonna start off by just inspecting it. Everything looks normal, it seems symmetrical. Do not see any hernias or anything like that. And then next, we are going to auscultate the 4 quadrants of his stomach. Hear bowel sounds in the first. You can hear bowel sounds in all 4 quadrants. Next, I'm going to percuss the stand of the liver to see about how large it is. You can feel that the liver span is right here, and then it starts to go dull when you can't hear it any longer. Now I'm just going to palpate the 4 quadrants of his stomach. First, I'm just going to start off with light palpation. You have any pain while I'm doing that?
No.
Okay. I'm going to go into a mid palpation. Good. Now I'm going to go into a deeper one. If you can just try to relax your stomach for me. Thank you. Don't feel any abnormalities in his stomach. You can sit back up for me, sir. Now I'm going to check the range of motion in his legs. If you can push up against my hand with your leg. Good. Same with this leg. Good. Now if you can pull back up against my hand. Good. Same with this leg. Good. Now if you can put this leg up in the air. Hold it. Go against my resistance. Good. Same with this leg. Good. And now same thing with your feet. Gonna push like a gas pedal. Push up against. Good. Now pull back towards your nose. Same with the other foot. Pull back towards your nose. Good. Now I'm going to feel for his popliteal pulse. Found the popliteal pulse is probably a +1. Feeling the posterior tibial pulse. Can feel it. It's a +2. Now I'm feeling the foot pulse. dorsalis pedis. That's a +2 on that side as well. Now I'm going to go to the other foot. +2 on the foot. Also a +2 on the posterior tibial. Now I'm going to feel for the popliteal again on the left side. It feels like a +1 there as well. I'm going to check for cap refill in his feet. I'm going to take off your socks, sir, okay? It's less than 3 seconds on the right side. Less than 3 seconds on the left side. So his range of motion and strength seems to be good in his legs. Cap refill and pulses were okay. Gonna now check the deep tendon reflexes. They're present in the knee, on the right side. They're present on the left side as well. Now I'm gonna check the foot. Just relax your leg. They seem to be minimal on the right foot. And they're present on the left. Maybe a little bit minimal. Throughout the exam, I could tell that he could hear me okay, and I could also tell that his speech was intact. I am now going to look in his mouth. You can pull down your mask for me, sir. Open your mouth. I can see his tonsils in the back, and they are not swollen. And if you can say "ah" for me. Good. I can see his hard palate and soft palate are intact. He doesn't have any lesions on his mucosa. All of his teeth are intact. Now look on the bottom side. You can put your tongue in. There you go. Tongue seems okay as well. Okay. I'm going to get you to stand up now for me. And if you can put your hands straight by your side and close your eyes. And you're just going to stand there for 20 seconds. This is the Romberg's test. It tests for balance. He doesn't seem to sway or have any difficulty doing this. You can sit back down, sir. Good job. Now I'm going to get you to do what I'm doing. So we're going to pat our knees. Good. Now we're going to do this. Good. And now let's touch each finger to your thumb. This is part of the cerebellar test for fine motor. Good. And if I can get you to lay back down for me. Now can you take your heel and put it down your shin and put it back up? Just do that. Good. Now do it with the other foot. Good. This is also part of the fine motor. You can sit back up for me. Thank you. And now I am going to fill in your scalp. Don't notice any lesions or lumps in the scalp. Hair seems to be okay, free of any lice and is well groomed. Now I'm going to get you to turn your neck to both sides for me. Can you do that? Everything feel okay while you're doing that?
Yep.
Okay. Well, thank you for letting me do a physical assessment on you today,
You're welcome.
and I hope you have a great day.
Thanks, you too.